Hey everyone, welcome. Today we are going through chapter 5 of Unlearn Your Pain by Dr. Howard Schubiner. I'm admitting some people here if I keep looking over, and some people in the chat. Hey Laura, hey Roseanne, hey Mary. So good to see you guys here today. This was a great chapter for providing a lot of evidence for understanding if your pain is mind-body syndrome or not. So hopefully this was helpful for you guys. I know there's probably some of you out there that didn't find your condition listed, but what he says is there are two processes basically ruling out that there's a structural cause. Usually that's things like a fracture, a tumor, or some bone-on-bone arthritis could be a case. But there's also ruling in. So he talks about if you're still kind of unsure about your situation, it's not one of the clear-cut ones that he talks about, then you can use what he's described as the fit criteria to rule in that you have mind-body syndrome. So as usual, I have some slides to go through. I've really loved that way of presenting the information. And then I'm sure we'll have some time that we can go through questions, and I'll keep an eye on the chat if you guys have thoughts or questions that come up as we're going through. So I'm gonna share my screen here, get them set up for you. Welcome, guys. Someone's still joining here. Okay, we're gonna go to presentation mode, and here we go. All right, so chapter 5, do you have mind-body syndrome? So if no serious medical or physical disorder was found, so he always encourages you to get testing, to get, to rule out what you can medically. So if there's no fractures, cancer, heart disease, no infections, no nerve damage, no clear tissue pathology, then you very likely have mind-body syndrome even with a biomedical condition. So say that you do have heart disease or a stroke. Some people may also benefit from the techniques of this book. So techniques that calm the mind will help people with most any kind of chronic condition, whether it's determined to be mind body or if it is something like cancer, there is still stress and emotional reactions to stress that can exacerbate medical conditions. So many people have had some relief, some degree of relief by applying these techniques, even if it is one of those conditions. So many people with chronic pain, anxiety, or depression have histories of significant stressful life events. We've talked about this before with like the ACEs score, the adverse childhood experiences, but this is not always the case. Many people have normal childhoods without significant trauma. And Dr. Schubiner says he's one of those. I think I'm one of those too. Had trauma later in life, but as a child, not so much. And mind-body syndrome, remember, occurs in most people at some time of their life, at least to some degree. So this is not just some rare thing. This is more common, actually, than many of the medical conditions we're claiming them to be. They're caused by the nervous system and brain. So people, especially who are sensitive and tend to put pressure on themselves by being overly perfectionistic, having excessively high expectations for themselves, and people who put others' needs before their own or have difficulty taking care of themselves or standing up for themselves are at particular risk for mind-body syndrome. So I really resonated with that. I wasn't so much a victim of a lot of trauma in my childhood, but definitely had those personality traits of someone who has mind-body syndrome. So reversing mind-body syndrome doesn't always require identifying or processing the stressful life event or the emotions connected to it. So sometimes people are worried like, well, I've had a lot of trauma, so does that mean I have to go back and find out everything that happened and deal with each of those things? He says, no, it's definitely not necessary to find everything out and figure everything out and process it all. It may be as simple as reprogramming the brain to reduce the danger alarm mechanism and calm ourselves in the face of mind-body syndrome. So when we have a symptom, calming ourselves, teaching the brain that it's safe, decreasing that danger alarm mechanism can teach the brain to stop producing that symptom. And we don't necessarily have to go through and relive every childhood experience. So common mind-body symptoms. So he goes through probably, I don't know, we'll go through them all, like 15 or 20 diagnoses that are very, very commonly mind-body syndrome. Tension and migraine headaches. So there are some things like, if there is a brain tumor or infection, those kind of things you would rule out with your doctor. But most tension headaches, cluster headaches, and occipital neuralgia are forms of mind-body syndrome. A lot of times people try to modify their environment. They notice foods or weather or the seasons or light or sounds that they are basically triggers for their headaches. So they try to avoid certain foods and have these, big protocols of how to live, avoiding certain things. And they're actually not the cause of the headache. They are the events that trigger that danger mechanism and they turn on the headache. But the good news with this process is you don't have to go on a restrictive diet and do all these things because we can just unlearn that danger mechanism and teach the brain not to produce it. Irritable bowel syndrome, IBS, and chronic abdominal pain. So it's interesting because he says, first sentence is like, if it's something like ulcerative colitis or Crohn's, that is something biomedical that needs to be treated that way. But if you know my specific history, I actually had ulcerative colitis that is now disease-free. And then the last time I got a colonoscopy, he said, if you do have any symptoms, it's IBS. And IBS is one that is pretty much exclusively mind-body syndrome. There's not a whole lot of debate about it unless you have, like he said, one of those inflammatory conditions, or he mentioned celiac disease. But IBS itself, although it does cause physical changes in the body, with bloating or cramping or gassiness, it's not caused by any damage to the bowel. And it is worsened by stress. So that's a good clue that it's mind-body. So certain foods are not the cause of IBS and abdominal pain unless you've been diagnosed with lactose intolerance or gluten enteropathy, which is celiac disease, based upon rigorous medical testing. Most of the time, I know, for me, they're like, here, this is what you have, and here are the foods to avoid. But with this method, you can actually eat all of those foods without the symptoms when you train your brain differently through this method. Okay, neck and back pain. We've already talked about neck and back pain a lot in previous chapters, but just this concept, if you have a mild injury, say you twist something or you lift something up or you turn over in bed, he said that's unlikely to cause an injury, but say you do twist or pull something, mild injuries will heal within a few hours or a day or two at most. So if it is getting worse, if it doesn't even show up for a week, or if it lasts for days or weeks, it's almost always mind-body syndrome. He has Dr. Schubiner has some great cartoon videos explaining pain. And one of them is called All MRIs Are Abnormal. So basically, if you're even a teenager or an adult, definitely if you're past your 20s, your body will show some kinds of abnormalities with an MRI. What we're looking for, what we want to rule out, like we said, is fracture, infection, evidence of an inflammatory condition such as ankylosing spondylitis or a tumor. Then medical treatment is necessary. But he even says, herniated discs will heal. So most of the surgeries are unnecessary that people are having for back pain. And the rate of success of back surgeries is very, very low. So definitely, if you can take this mind-body approach, it's very helpful to most people, excluding those extreme conditions. But, we're talking like 80–90% of people that have chronic back or neck pain. It's not from a structural cause. So fibromyalgia is an interesting one because the pain is widespread and it's chronic, but if you even have that diagnosis, that means that they have already ruled out any structural components. So the diagnosis of itself means that it's mind body syndrome, right? Because they've ruled out all the structural causes and you still have this mysterious pain according to the medical system, but it's very clearly explained with mind body syndrome. So there are many theories linking fibromyalgia to a physical cause. I've heard that with, well, maybe it's autoimmune actually, but none of those supposed causes have been validated to date. And Dr. Schubiner has actually done some specific research himself on cases with fibromyalgia. And so he has found that when people are able to like express their emotions and start to change those personality traits, then their fibromyalgia symptoms go away, and they go away more and stay away longer than if you just have traditional cognitive behavioral therapy. So he's a little bit of an expert in fibromyalgia specifically. Osteoarthritis, that's just basically the wearing away of the joints with age. And again, if you looked at just about anyone, I bet I have some places with osteoarthritis for sure. And it's seen in people that don't have pain. So it's like those back studies that we've seen. People that don't have pain also have herniated discs and spondylolisthesis, all these things that don't cause pain. It's the same with osteoarthritis. And he even says here, this is a change since the last version of the book, that bone on bone arthritis even can be misleading and not the cause of pain. So make sure you're investigating the pain like we're going to do later with the fit criteria. So like, for example, if the pain comes and goes, if it's better on some days than others, if it's triggered by weather or stress, that's a sign that it's mind body pain, not osteoarthritis pain. So the diagnosis can be misleading, and especially if get, it's like mild or moderate diagnosis or bone on bone arthritis, that can cause a lot of worry and pain. And when you have that symptom in the future, that's what your mind might go to. But knowing that you could have that damage, you could have those abnormalities, sorry, anomalies, tried to combine two words there, abnormalities, and it doesn't have to be the cause of your pain. If it was causing pain, it would cause it all of the time. It wouldn't be better some days and worse other days. It wouldn't be better in the afternoon and worse in the morning, right? So that's what we'll go through in the fit criteria. Pelvic pain syndromes. So some of these diagnoses you might have heard of: pudendal neuralgia, pelvic floor dysfunction, vulvodynia. Oh, I think I did a typo though. Coccydynia, I think that one is. I'm like, if I get through all of these and pronounce all of these names right, I'm going to be doing really well. But you can always reference them in the book if you're looking specifically. So these diagnoses, it's basically saying you have pain in this area. It'd be like have pain in the vulva area. So vulvodynia means pain in the vulva. So it's not a diagnosis of some structural problem. It's just describing where you have pain. Endometriosis is one where the tissue can grow outside of the uterus, and it's often not the actual cause of pain. So I actually worked with a OB doctor, a surgeon, and coached her. And she actually verified this from the surgeries that she's done. She said sometimes people will have a lot of pain and barely, barely, barely any endometriosis at all. She said barely a drop. And then other people may have a lot of pain. They go in there and they find, did I say that backwards? Basically, they could have a lot of pain with little endometriosis. They could have no pain and a lot of endometriosis. So it's, again, one of those things we've been blaming symptoms on, but we're starting to realize actually occurs in pain-free people as well. Again, you can figure this out by ruling in, going through the fit criteria, and careful investigation of the symptoms. Heartburn or GERD, so reflux, you might hear that called. This one was so interesting. I've coached another physician actually that was getting off her heartburn medicine, and she would experience this like a phantom burning and even a sour taste. And Dr. Schubiner says the brain can generate those symptoms in absence of that material escaping from the stomach. So usually we think of it as the acid from the stomach is coming back up and that's creating that taste and that burning. But even when the symptom isn't occurring, the actual stomach acid isn't coming up, the brain can still produce that symptom, right? So that can be stress related. And you could do barium testing or EGD or a pH monitor to determine if it's actual stomach acid that's coming up or just that brain's neural circuit for that it keeps producing during times of stress. So if acid blockers aren't working for you, it's likely mind-body syndrome. He says even if acid blockers do work, that could be from the placebo effect. So this is one that you'll definitely want to look at all the fit criteria, all the childhood stuff, and you may find that this symptom can go away for you. I've worked with quite a few people that have reduced the symptom even when pregnant because it was so stress related. Okay, tinnitus or tinnitus, depends on how you say it. I say tinnitus, tomato, tomato, but basically it can happen if you have some damage, like you went to a really loud rock concert and you have some ringing in your ears for a few days. But most chronic tinnitus, there's no actual ear damage and it's due to a mind-body condition. And usually it's going on when there's something upsetting in life. So when there's a stressful time and you're getting this ringing in your ears and you haven't recently gone to a rock concert, it's probably a good chance it's mind body. Persistent ringing in the ears is almost always due to a neural circuit or mind body condition, unless there's definite damage causing hearing loss and imbalance. So again, you're working with your doctor to assess these things, but in the back of your mind, you can also know some of those diagnoses you get. It's another name for just pain in the area or description of what's going on, swelling in the area, but could still be mind body. So dizziness and vertigo, lightheadedness. And so like when you stand up and you get lightheaded or that feeling of the room spinning, that's vertigo. It's very common that these are neural circuits, especially if they're persistent. And medical testing can rule out any problem with the brain, heart, or ears. POTS, so postural orthostatic tachycardia syndrome. Whew, that's a mouthful. It sounds scary, doesn't it? Basically, when you stand up, you can get dizzy and a rapid heart rate. And people thought that it was due to a heart condition, just something that you would have to deal with the rest of your life. But now they're finding it can go away with this treatment, and it is actually a mind-body condition. Muscle tics and spasms. So muscle tics and spasms are normal. I get little twitches or sometimes a Charlie horse type of thing. It's almost always due to the brain's neural circuits rather than any disease. The muscles and nerves are not damaged. They're just being activated by the brain. You know, those neural circuits can run to every single muscle fiber and every muscle. So the brain can activate just one little twitch. My leg was doing that the other day, a little, they call it fasciculation, where my leg was just twitching. And it wasn't painful and it wasn't chronic, so I wasn't worried about it. But these things are occurring in all of these people, in normal people all the time. Okay, so dystonias fall into this category. So that might be a diagnosis you've heard of, dystonia. If you haven't experienced it, you might not have heard of it, but good to know that this, like, basically it's like a fluctuation in the muscle tone that is mind body. Okay, non-epileptic seizures, PNEA, that's the proximal non-epileptic attacks. Need to like do those mouth exercises before I get on here for all the articulation. So I read this interesting study that was saying that chronic stress can mimic a lot of medical conditions like brain tumor, MS, and epilepsy. So when I saw this, I thought of that study. So it can look like they're having a seizure, but in reality, it's the same, process of having a seizure. It's not under their control, but it's not from a medical condition. And that's easy to diagnose using an EEG or monitor test in a neurology unit. So again, if you're ruling out something and you don't have any abnormalities on the EEG, but still have even these violent reactions, that can all just be caused by mind-body syndrome. Okay, the loss of voice, which is aphasia, or change in the voice pattern, spasmodic dysphonia. So these are almost always neural circuit. Medical testing will rule out any specific vocal cord or neurologic disorder. Probably don't need to talk about that too much, but I have met someone who had that spasmodic dysphonia, came on during a time of stress. I didn't know her very well, but I just gave her a reference to this book, and because she was just basically told, you're going to have this the rest of your life. But I noticed as I talked to her, there were sometimes she got talking about things she really enjoyed, or she was distracted or passionate or something, and her voice sounded normal. So super interesting. Okay, brain fog and inattention syndromes. You'd want to rule out ADHD or dementia, but I even just heard recently another case of I think it was a research study showing that chronic stress can mimic the symptoms of ADD or ADHD. So if you haven't had it in your childhood, but you have all the symptoms of ADD or ADHD as an adult, that actually could be from chronic stress, not necessarily abnormalities of your brain. Most people have lapses of memory. I've totally noticed this. Even my kids, my daughter might say oh, I'm so ADD, or oh, I'm just a blonde, or a mom might say, oh, I have mom brain, or a pregnant woman might say, oh, it's, pregnancy brain. And if you're older, you're like, oh, my memory, I'm losing my memory. We have all these excuses for when we forget things. But the truth is, I've watched so many people, it's a common occurrence, even with very intelligent people or very articulate people in the middle of their sentence, they'll lose their train of thought. This can happen with, mind-body syndrome, chronic stress, or just that active nervous system. So significant inability to concentrate and remember things are usually due to a mind-body condition. Tingling and numbness sensations. I find this one so interesting because I've worked with people. There was this physician that she had some back pain and that went away. And then she started getting tingling and numbness sensations. And so she was convinced that this was no longer a mind body thing, because why would she have this nerve sensation? Usually in the medical community, tingling, numbness, burning, that's all a nervy type of pain. And so she was convinced that there must be actually something going on with her nerve. Otherwise, why would pain be going down her leg? Turns out it was mind body, but it's common to think okay, I get that a muscle strain feeling might be mind body, but when it's tingling or numbness, that means the nerve is actually damaged. Usually not. So medical testing, as always, is necessary to rule out if there's actual nerve damage or vitamin deficiencies, chemotherapy, or an alcohol use disorder. But if you have a diagnosis of small fiber neuropathy, he says that is mind body. Idiopathic neuropathy, idiopathic means they don't know what it's from. So that alone tells you it's probably mind body because they can't find anything medical for it. There's no evidence of nerve damage. But even if you get an EMG and it shows mild damage, that is normal for people without pain. So again, it's one of those things that you might get, oh, I did have some mild results. And there might be another person that has none of those symptoms. And if they were tested, also had mild results. So as we get doing more and more research of pain-free people and what's normal, we're finding more and more that all of these kind of symptoms are usually mind body if they're chronic, and it's not because of something structural. So even, this is crazy, even skin biopsies, that people, they get diagnosed with small fiber neuropathy with a skin biopsy. That could be diagnosed in a normal person that doesn't have those symptoms. So I know it gets really confusing, but he does a good job here of helping you weed through all of the, things you've been told by the medical system and what it means in this world. And basically, even if your symptoms are not here, the fit criteria that we're going to talk about later will really help with determining if your pain is mind body or not. Okay, so TMJ, temporal mandibular joint disorder. He said that usually people think of it as because you're clenching or grinding your teeth, but research shows that people with teeth clenching and grinding at night do not have TMJ pain any more than other people do. So again, one of those things we've always kind of believed. And then we see some people grind their teeth and clench and have zero TMJ pain. And they might even show damage to the temporal mandibular joint. So again, that's another case of like, well, they did an x-ray, they saw some damage. That's also seen in pain-free people. So it's usually a mind-body condition when it's investigated carefully. I've definitely seen people with that TMJ pain that really related it to the emotion of anger, because a lot of times that has a clenching action in the jaw. Urinary frequency or interstitial cystitis, IC. This is a kind of a cool one. I learned that urinary frequency and incontinence could be mind body from Dr. Sarno's book. And I tested it out with myself and have been able to cure incontinence. And I have a podcast about that, an episode about that on my podcast, Unstoppable Body and Mind. And definitely, I noticed with the urinary frequency, there were certain times that I would get more urgency. And so that was my big clue that it was mind body, because I'd be fine talking to someone for an hour. And then the last minute before we're going to say goodbye, all of a sudden this urgency. So anyway, keep looking for these patterns, but the nervous system affects all these different systems of the body. So frequent urination and bladder pains are common conditions that are rarely due to structural damage. Studies show evidence of mild bladder damage in normal people who have cystoscopies. So again, it's so confusing, right? You're like, but I have this diagnosis and it's mild bladder damage. A lot of people without pain have that same kind of structure if you looked. Okay, so diets, usually people are given diets of avoiding certain foods. In fact, I was convinced that caffeine was a bladder irritant. And so on days that I did drink coffee or had some caffeine, I would be like, oh, that's why I'm not making it to the toilet every time. But now I'm able to drink coffee, go right to a Zumba step class, do a whole step class. I mean, it's amazing when you change your frame and you decrease the fear, those symptoms can go away. So if you are on a restrictive diet, it's the same with like IBS, that usually leads to more problems than solutions, and it's not necessary. Because like it's stressful to have a restrictive diet and to have to think about, are you going to have safe foods or not? And sometimes what you really, really want is one of those foods you can't have. All of that stress is unnecessary. Palpitations, heart palpitations. This is common in many people. The palpitations or skipping beats or extra beats, almost always benign, that can be due to stress. Do cardiac testing, right? I've had people, their leg pain goes away, they start getting heart palpitations, they get on a heart monitor for a month, and they realize, okay, it's stress related. It's not a functional condition. So rule out atrial fibrillation or ventricular tachycardia, but most of the time it makes sense, right? When we're in fight or flight, our heart rate increases so that we can fight or run away. So notice that if you have those palpitations, what else is going on during those times? Facial pain or trigeminal neuralgia. It's almost always due to neural circuits rather than any structural damage. Testing may even show some compression of the facial nerve by arteries or veins, but this finding is common in those who have no pain. So again, So crazy, right? Do the careful investigation, the fit criteria that we're going to talk about. And I have a crazy story of facial pain that, like, I'll try to tell it really quickly. I've told it before, but I had an implant that had to be redone, a tooth implant. And I did not like that. I was really mad about it because it took a lot of time. I had this gap. It was like $3,000. I didn't want to do it. And then as this process was going, where I was getting this one replaced, I saw a picture of myself with a lower tooth that was getting an implant. And so there was that gap there. And later that day, I got sensations in that tooth, like the same kind of like loose sensation I had had in the upper one. I got it in this bottom tooth on the other side. And then that even turned into facial pain and numbness that lasted for about a day. And I the next time, and then it went away. I was really suspicious it was stress related, especially since I had just seen that picture and then my brain produced the symptom. It was crazy. So I happened to have a dentist appointment that week. By then the symptom had gone away. But it had spread all the way up into my face, my whole half of my face. And I asked my dentist about it, and he said, "Oh, it's just probably stress and clenching your jaw." But he looked at that tooth and nothing was wrong with it. So very real pain can happen with no physical cause. Chronic regional pain syndrome, CRPS. It used to be called RSD. Back when I was in physical therapy, we called it reflex sympathetic dystrophy. So this one can be deceiving because people think this one has got to be structural. There's actually skin changes in the hand or foot. It could change color to red or purple, or the skin could change to hot or cold or have swelling. But CRPS has been shown to be reversible using the mind-body approach. Um, if you remember too, I think it was in chapter 1, maybe 2, they did a study with people who had CRPS, and they had them imagine doing a hand motion. They showed them a picture. They imagined doing that motion with their hand, and they actually created swelling in those joints just by imagining doing that hand motion. So we know that the brain can produce inflammation in certain joints, you know, with mind-body connection. Okay, eating disorders. This was one I didn't realize. I had an eating disorder during college and didn't ever connect it to this is another mind-body symptom. Anorexia, bulimia, and overeating disorders are common and almost never found to be due to something underlying with the brain or a medical condition. They're also mind-body disorders. So anxiety and OCD. Again, often this is classified as something medical. Something's wrong with your brain, the amount of serotonin, or this is just some mental illness, right? But anxiety disordered, disorders, including generalized anxiety, social anxiety, phobias, and OCD are almost always due to a mind-body connection. It could be because of excess thyroid hormone or hyperthyroidism. So rule out that. But otherwise, anxiety is actually a really, really common one we see with people who have mind-body syndrome. It's also common for people to decrease their pain, that they're working on. They come for back pain, that decreases, and then they get this increase of anxiety. And most of the time, when we can address that underlying health anxiety, it's so helpful for preventing new symptoms or for new symptoms to not last as long, because most of the mind-body syndromes can kind of be described as like an anxiety disorder, right? We have a symptom and then we have fear about that symptom, and that amplifies it and causes the pain to produce more. Depression is almost always a mind-body condition. Again, he says hypothyroidism, so very low testosterone in men, and a few other hormonal conditions should be ruled out. But he says menopause is not a cause of depression from a hormonal standpoint, because there's a really cool study where they found that people who, in cultures where they respect older women, have very little problems with menopause, very little symptoms, if any. Okay, post-COVID syndrome and long haul COVID. This is new from the other version of the book because this is one of those newer things that we're starting to see now. 10% of people who've had COVID-19 have developed a variety of symptoms, like long chronic symptoms such as shortness of breath, fatigue, headache, brain fog, and others. He said some of them haven't even had COVID or had it very mildly, but usually it's from the mind body approach, or it's helped by the mind body approach. Usually it's from those neural pathways, neural circuits, and the habits of the brain. So, yes, Tanya says, isn't it a serotonin decrease in the brain that causes depression? So he does kind of talk about that. He says, they'll say maybe it's because of serotonin, but it's kind of one of those chicken or the egg things. Like, is the decrease in serotonin because of the anxiety patterns and stress, or the freeze basically is usually depression, is more of the like freeze state. So yeah, he has a whole book called Unlearn Your Anxiety and Depression, and really makes a great case that it's all mind body. And like he said, maybe there's something hormonal with like testosterone, but as far as serotonin, that's controlled by the brain and nervous system. So with mind body syndrome self-diagnosis, step one is ruling out the medical condition. So most of you who are here have already been to a lot of doctors, you've gotten all the testing. That's usually people's first line of action. But if you're trying to rule it out, definitely, like, if something's chronic and you get an MRI or something, you're looking for like fracture, infection, tumor, things like that. Okay, so he has some lists here. This is where the like workbook part of the book begins. So you can write down answers to this, just in your book or someplace else, but try and go through all of these questions if you are struggling with diagnosing yourself, if it's mind body or not, because the process of going through all of these will kind of jar your memory, maybe stir up some more questions, or to create some evidence for yourself. But go through this and see, like, maybe some of these things were happening when you were in elementary school or high school. I know I had a lot of like sore throats and had my tonsils taken out, and I had a lot of stomach aches as a kid. And like I said, the eating disorder thing, I didn't really relate to another version of mind body. But see if you've had any of these. And I think that's Renee, says, I was shocked to realize I have most of these. Yeah, right. Like I said, with the incontinence, I was like, well, that's a totally different issue because I've had 4 kids. Turns out it was mind body. And then, yeah, PJ, hard to remember when some of the symptoms started. Yeah, don't stress yourself out too much about like, was it in May of 1983? But you might be able to just generally be like, in my elementary school years, or this was when I was a teenager, or, this was right after my 3rd kid was born. Usually there's some kinds of things you can relate it to. And does he address seasonal allergies and the IBS connection? I haven't heard of the seasonal allergy and IBS connection. That's interesting. Not that I've heard of, but definitely I know he says like that example of like fibromyalgia. Some people think it's autoimmune, hasn't been proven. I'm guessing it's something like that, but well, no. IBS is very, very clear cut, like mind body. And yeah, I'd like to hear more about that, Judith, if you have more information about that. But I've had people get off of their allergy medicines and no longer struggle with allergies when they do this work. So myth number 1, an old injury can be the cause of pain. This one is so common, right? I talk to people that are like, well, I have abused my body for years. I was an athlete. I was in this accident in my 20s. I, have this poor posture because of this accident and my shoulders up higher on one side than the other. None of that. None of that is going to cause you chronic pain. And as a former physical therapist, I know that sounds pretty weird. It kind of goes against what I learned, because basically I would look at people and see, are they symmetrical? Is there more strength on one side than the other, or more tightness? And, let's get this perfect symmetry and perfect posture, and then you'll feel better. It's kind of perfectionistic. But what we find is that there's people with all kinds of asymmetries and bad posture, and they're not having chronic pain. So an injury can clearly cause pain. No one is disputing that. If you break a bone, you're going to have some pain for a while. But if that pain persists after the injury heals, and a really gracious time period is 3 to 6 months, usually broken bones heal in 12 weeks, 8 to 12 weeks. So, giving yourself 3 to 6 months and it's lasted longer than that, and maybe even years or decades, that's a good clue that it's mind body, that it's these neural circuits. It's the brain continuing to create the pain, nothing more, right? Posture doesn't matter that much and has been shown in many research studies that posture doesn't change things. As far as chronic pain, scars do not cause pain. There are no nerve fibers in scars to cause pain. Judith, so our allergies, mind body. I don't think he specifically addresses allergies. I can look a little more into that. I'm pretty sure he doesn't, but especially if your allergy medicines aren't working, or if you're just kind of curious because you're the type of person that has a lot of other mind body conditions, I've seen it change. Absolutely. I'm not saying that's listed anywhere in the book. I don't think he really talks about allergies, but I did coach this one doctor who was an immunologist, and she said that allergy tests can be inaccurate even from one day to the next. So it was so interesting. And I've had people that say, I just got my allergy test back and I'm allergic to all these things I've been eating without any problem. So it's a gray area. And tendinopathy, yeah, is mind body. If it's ruled out, there's no fracture, there's no infection, there's no tumor in that area. It just means the tendon is where the pain is. Tests for okay, myth number 2, pain is caused by inflammation that cannot be seen. So much is focused on inflammation and anti-inflammatory diets, and it's the inflammation that's causing my pain. But Dr. Schubiner, if you ever want to engage him in something he's really interested in talking about, it's this idea that inflammation causes pain, because he really believes that everyone has microinflammation in their body to some degree. Like, that's why we need to floss our teeth and get the infection out or whatever. He talks about how microinflammation is common in all of us. So tests like the ESR or CRP can be elevated in many people, especially people who have a lot of pain or stress in their lives. But this type of inflammation is not the cause of pain. So that's an interesting point, because sometimes people say, well, mine's inflammatory. He doesn't say this here, but the way I see it is the nervous system controls inflammation. So it totally makes sense that when you do these stress relieving techniques and calm the fear, your inflammation goes down as well. But sometimes people really tie their pain to something they've eaten or something they've done. And I've heard some crazy theories of, like, I can't eat cheese because I have this inability to process the magnesium, but cheese is something they just love. And it can be so confusing. But generally what we're finding is those diets for inflammation just stress you out more than help you control your inflammation that's stress related. So you want to also look to ruling in a mind-body condition. So this is an interesting point, right? We can rule out that it's something medical, which sometimes leaves us some gray areas still, but we can also rule in that this is mind-body based on how structures would behave when they're injured versus when it's mind-body. So if it's persisting long after an injury is healed, Oh, I already did that one. Okay, so the fit criteria, we'll try to go through these all pretty quick. So we're taking a lot of time, but just put in the chat if you have any questions. I don't know if we'll get to any. Okay, and Laura says, I think somewhere in the book it says allergies can be positively influenced by mind-body work. Yeah, that's my experience too. I think he might be more hesitant to say a blanket statement of allergies are all mind-body, and then someone goes and eats some peanuts or shellfish or something. But for the most part, we're talking, just in any kind of condition, that number gets thrown around of like 80 to 90% is due to mind-body versus things that are actually structural. So functional, this means the symptoms of mind-body syndrome do not fit with and are not explained by a known structural condition. So symptoms that begin without any physical cause. So like you wake up in the morning and you turn your head and you get pain, that's not an injury, right? That's not showing that your muscle just, popped or something, right? It's like more likely a time of stress, and small movements like that. Say it did get injured, he says it will start to heal within hours or days, but symptoms that you're especially like nothing really happened, but maybe the night before I was dancing and then I wake up with pain in the morning, doesn't necessarily mean that you injured something when you were dancing. So symptoms persist after an injury is healed. We just talked about that. Symptoms are in a distribution pattern that's symmetric within the body or mirror image, right and left sides. So if you get carpal tunnel in both hands at the same time, it's likely not due to the same damage in both sides of your hand exactly at the same moment, right? From chronic typing, right? If you have bilateral symptoms on both sides of the body, or it goes from one hip to the other, it's a good sign that it's mind body. It rarely occurs with structural pain that you have both sides of the body affected. Like if both legs are numb, you would have to have that compression right in the middle affecting both nerve roots. And usually that's not the case. Okay. Symptoms occur on one whole side of the body or occur on half the face, head, or torso. So we don't have one nerve that runs the whole right side of the body, but that is a clue that it's mind body. Symptoms spread over time to different areas of the body. So it started in my lower back, and now it's in my upper back and my middle back. And now, all these parts hurt. Good sign it's mind body. Symptoms radiate to the opposite side of the body or down a whole leg or arm, unlike a nerve pain that would affect only part of the leg or arm. So just because you do have pain in a nerve pattern, it doesn't necessarily mean that it is structural, but definitely if you have pain that's not in a nerve pattern and it's the whole leg or the whole face or the whole half, then that's more likely mind body, not a specific nerve. Symptoms that occur in many different body parts at the same time, also a good clue that you're a mind-body candidate. Symptoms that have the quality of tingling, electric, burning, numb, hot, or cold. These are commonly mind-body when there's no evidence for actual nerve damage. So I'm going to run through these real quick. Inconsistent. This means the symptoms vary in ways a structural condition would not. So symptoms shift in the location from one body part to another, either within hours, days, or weeks at a time. So the thought is like, if you had a broken bone and it was like in that healing stage where it's very acute and it's not splinted, it wouldn't be like, oh, I just didn't feel it for a while and then I did. And if you have an injury, it should be like a consistent sensation to you. And when it comes and goes or shifts location, oh, my back pain is less, but my neck pain is worse today, that is a good clue that it's mind body. Symptoms that are more or less intense depending on the time of day, or if they occur first thing in the morning or the middle of the night, that's due to subconscious brain activity. So if you have those patterns, that pain patterns vary during the day, and especially if your pain is occurring at night or first thing in the morning, you could rule in that it's mind body. Symptoms occur after, but not during activity or exercise. A structural injury hurts when it's used and it's better when it's rested. So that's that example of like someone who says, I went dancing and it felt great and I felt good when I went home. And the next morning I woke up and I was just sure I'd injured something. Really? Because wouldn't you feel it if you broke a bone? Wouldn't you feel it in that moment? Unless you're being chased by a tiger. But, if you're just having fun, you would know if you injured something, it wouldn't start days or weeks later. Symptoms occur when one thinks about them or when someone asks about it, right? So that's a good clue. Someone's like, "How's your back?" And all of a sudden you're like, "Oh, yeah," and it starts hurting more. Symptoms occur when stress is increased or one thinks about stressful situations. I've definitely had that. Thinking about, something coming up, my stomach starts to churn. Symptoms are minimal or non-existent when engaged in joyful or distracting activities, such as when on vacation or when not thinking about the symptoms. I worked with this woman who she went on vacation. She had a lot of back pain, went on vacation, had no back pain, was like riding in SUVs and bouncing all over the place and had no pain. She goes home, starts getting pain, and then her doctors and therapists were telling her, physical therapists were telling her, it's because of that SUV that you rode in and all of that bouncing. But her pain didn't start until a week later. Like that just does not make sense. And she was having fun. She was loving that vacation, so surprised she had no pain. And then the pain started when she came back and, had the stressors of life. Okay, this is an interesting one. If you have some kind of therapy, like a massage, chiropractic, Reiki, acupuncture, an herbal or vitamin supplement, anything that calms the danger signal, and then you have minimal or non-existent symptoms after that, it's likely because of Mindbody. And again, it's maybe partially kind of the placebo effect, but it's like a massage would calm your nervous system and decrease the symptoms. For some people, chiropractic might increase their fear. So if you're, going to some of these treatments, it's not as much the treatment, but are you in line with it? Does it seem like it will help you? Do you have trust and faith that it might work and you have less symptoms? That's a good sign it was Mindbody. What about muscle soreness that hurts after an activity and calms down after a few days? Yeah, generally they call that delayed onset muscle soreness. And so that is an example of like, it's not hurting while I'm playing tennis, but the next day, like all my muscles are hurting because I haven't been playing tennis. And so what's interesting, I've just, you know, I love exercising and movement and stuff. So I've been watching myself since I learned about this. And I've found a lot of times when I have delayed onset muscle soreness, it is when I'm like, oh my gosh, this is going to hurt tomorrow. I bet I'm going to feel this. I'm doing an exercise, I'm feeling the burn, and I'm like, oh, I can really feel this. So as I've just noticed some of those thoughts and started modifying them, like maybe I won't be so sore tomorrow, I've found less of that pain. And when I do have that pain, I don't really freak out about it because it's sometimes just a sign of like, I use those muscles. It's kind of a good pain. In fact, some people will change their workout if they don't feel that pain because that's that sign of I've worked out enough. So that one, I don't know a lot of research on other than I've just been watching it in myself. Um, and someone says, do you think physical therapy is completely useless? Definitely not. Definitely there could be some acute pains, like you broke a bone and you lost some strength and you're getting that strength back. I think there are, things like ankle sprains but for a lot of chronic conditions, um, it can teach you the wrong message that the posture needs to be perfect. If you believe that, like, if I do these exercises, I'll feel better and you feel better, then it's a net positive for you. But depending on where you go and what you're told, physical therapy could bring more fear. And so then that would be a net negative. But a lot of physical therapists are actually being trained in Mindbody. So it's not like a cut or dry, this is good or this is bad, but it's more like how you're interpreting the, help and belief about what's causing it and what will help it. But sometimes people want to go back to physical therapy because, they've lost so much strength and then they get told all these things that increase their fear and increase their pain. So it could be good at graded exposure, maybe. Yeah, exactly. Like some people like to have a personal trainer or a physical therapist that helps them build their strength in what they perceive as a safe way. But again, it's more about your perception of safety than it is about the actual activities you're doing. Um, okay, there's one more question. Yeah, the answer of muscle soreness. Yeah, just remember to check yourself and just kind of, tune in. And again, like I said, I was so surprised to notice those thoughts in my head when I'm doing an activity and I'll be like, oh, I bet I'll feel this tomorrow. Like that was just so subconscious. I would always think that. So triggered, the fit criteria, FIT, and triggered is the last one. I think we can make it through. We're at our time, but um, this means the symptoms, and we have a huge slide to go through. I just like literally just copied it all and pasted because I was getting close to the end. But we'll go through them. Brought on by stimuli that would not actually cause a symptom physically. So things that are not related to the actual symptoms, such as foods, smells, sounds. Sorry, I'll say that again. Foods, smells, sounds, light, computer screens, menses, so that's periods, changes in the weather. So some of those are controversial. But usually when we question, like I always have back pain 3 days before my period, and we start to question this, sometimes people have found that change just with maybe it's not related to my period. Maybe I don't have to have it. Weather has been shown in research not to increase pain despite what most people think. So that's again a controversial one because people will be like, I didn't even know it was going to be rainy today. But the research shows that the barometric pressure really does not have an influence on pain. Specific movements. So sometimes people are like, it's always with bending over. So that means it's something structural. Not necessarily. That could just be predictive coding. So symptoms are triggered by the anticipation of stress, such as prior to going to school, work, a doctor's visit, a medical test, a visit to a relative, holidays, right? Social gathering, or during those activities. A lot of people are having more symptoms now because of the holidays. So that is such a good sign that it's mind body because it's related to stress. Symptoms that are triggered by simply imagining engaging in the triggering activity. So this is such a good one to do with graded exposure. If you imagine yourself bending over or turning the neck or sitting to standing, and you get pain or awareness in that area just by imagining it, that's like a sure sign it's mind body. Symptoms are triggered by light touch or innocuous stimuli, such as the wind or cold. So your nervous system may be highly sensitive to touch, but there's no physical damage with your skin that's making it sensitive to touch. Light touch doesn't actually affect the deeper body part where pain is being felt. Um, and most people with mind body syndrome have several of these features that make it easy to rule this condition in. If only one of the above characteristics of the fit criteria is present, that will be enough to confirm the diagnosis of mind body syndrome. It only takes one clear piece of evidence for a detective such as Sherlock Holmes to crack the case. The same is true for the diagnosis of mind body syndrome. So that's pretty bold, a bold statement that if you have any of these fit criteria, it's proof you have mind body syndrome. So go through those carefully. And Mary, what about the reverse? I think leg presses take my pain away. Yeah, exactly. It could be that conditioned response of, I was told that if I do this, or I have experienced that I do this, my back pain goes away. One thing you could play around with, Mary, is just imagining that you do the leg press. Visualize yourself doing the leg press and see if your back pain changes. But yeah, just because you do a structural physical thing and the pain goes away, that could just be predictive coding and your brain proving what it already believes is true. And you could play around with doing less leg presses and your back pain still going away. So we don't have time to go through all these, and it's in your workbook. Step 3 is investigating your childhood. And he has, I don't know, maybe 20 questions about just your relationship with your father, your relationship with your mother, your siblings, other childhood events. Take some time and go through this. It's really to your benefit. It's like creating an evidence sheet. of like, oh, okay, this does make sense. There are core issues that you might be dealing with or personality traits. So we've talked about, the high pressure and stress and perfectionism and duty to others. Go through the rest of this chapter with the workbook. I believe a lot of this is actually even on Dr. Schubiner's website. If you don't have the workbook part, I'm pretty sure I found all of these questions about your parents and creating this evidence sheet all on his website for free. So thanks you guys for joining. I think that's all I had. Yeah. Sorry we didn't get to any questions. I enjoyed watching what you were saying in the chat. And so I just want to address this. It actually takes 4 to 6 weeks to really build up muscle. So the brain is powerful if it thinks exercises help. Yeah, definitely. And that is like a question too, like, because sometimes we think this pain is due to weakness. And yeah, if it takes 4 to 6 weeks to actually change the strength, why would doing a few leg presses help? Probably because of that association we have. If it's working for you, great. And like I said, you might be able to wean away from that structural thing that you do to help the pain by just, some other ways, some other beliefs, and some other approaches. All right, you guys, thank you so much. Thanks for those of you who stayed. I'll be posting all this in the Tell Me About Your Pain Facebook group and the slides as well. And if you're on my mailing list, you'll get it. And I also post the replays on YouTube. All right, you guys, have a good weekend. We'll see you next week for chapter 6.